So we have a very broad range of things to deal with sexual dysfunction. Obviously, there's the first one, which is the PDE5 inhibitors, and that's the group of drugs like Viagra, Cialis, SPONTAN, Levitra, Spedra, all of those. There's also injectable therapies, which people are petrified of, and if you watch my YouTube channel, you'll see they're actually very easy, and you use like an EpiPen to do it, and it honestly doesn't hurt. And you're probably thinking, she says that she doesn't have a penis, but I've given thousands of these injections and they do not hurt. There's a lot more to erectile dysfunction than just using a Viagra. There's a whole lot of nuances to taking these pills that people often aren't told when they're given a prescription. If you take a Viagra tablet, for instance, it works much better on an empty stomach and you have to wait 1 hour for it to be in your system. If you take Cialis, which is tadalafil, you have to wait 1 hour, but it's not negatively affected by food. Every person responds differently to medication, so 5 milligrams of a medication might work really well for one person, but the next person might need 20 milligrams. So I also think it's important to have these regular touch points with a practitioner if you need them, because then we need to titrate the doses according to that person. It depends on your weight, your genetic makeup, how you personally respond to medication. And probably the most simple example I can give of that is some people, if they get a headache, Nurofen is the only thing that works. Other people, the only thing that works is Panadol. And that's because genetically, we're more likely to respond to a type of medication than another. So it's about figuring that out. The other thing is it's obviously psychological. There's a psychological component. So anxiety and depression and a lot of medications really affect your erectile function. So looking at someone's medication list is really important. And there are alternative medications for those issues that don't have such a detrimental sexual function. SPONTAN, the nasal delivery spray of vardenafil, is going to be and is already showing to be a really big change in the treatment of erectile dysfunction.